I'd like to introduce myself again today. My name is Greg Vigorin. I'm a dentist here in Newport Beach and Laguna Niguel. And the topic today that I'd like to try to integrate into all kinds of other topics that people think may not be related is airway. And I've been in meeting planning for now almost 50 years. And my job is to find the very best people on new topics with information that's valuable to an audience of anything from 200 to 50,000 people at some of these conventions that we have. And I'd like to introduce Mark Cruz, Dr. Cruz, who I've recently moved from a large office into a small office, and now am doing things down there in his office because I'm transitioning from just being a microscopic or magnification restorative dentist into treating and diagnosing airway problems. And that's from the tip of the nose to I'm going to cut it off at the esophagus, because that's rigid. And what happens in that space can cause all kinds of problems. So, as I said, Dr. Cruz, I consider him one of the foremost and most knowledgeable people in this space, both in understanding and in diagnosis and in treatment. And I think he's simplified something that was a major surgical correction and broken it into small pieces that are very easy to do compared to what the alternative was just a couple years ago. So with that, it's kind of hard to pick topics and lead-ins that will bring people to this video or podcast because no one is going to, or not that many people are going to search for airway. They're going to search for fatigue. They're going to search for anxiety. They're going to search for their children with learning disabilities and ADD and ADHD and all kinds of other topics. So at this point, let me turn it over to Dr. Cruz.
So, I mean, you can go in so many different directions with this topic. So, if there's any specific question to ask to kick it off, I think that could facilitate the conversation. But if not, I could first of all talk about what's airway. And there are a lot of people jumping in that talk about this term airway that I don't believe really understand what it is. What is the definition? Certainly we know the generic definition of the human airway, right? It's from the tip of the nose, all the way down to the lungs, right? And what does that have to do with dentistry? It's Dr. Donald Anlow, the grandfather of craniofacial growth concepts, craniofacial biology, wrote the seminal book, Essentials of Facial Growth, with Mark Hans some decades ago, that talked about craniofacial growth and development. One of his quotations is that the airway is the keystone for the face. And if you know what a keystone is, it's an architectural structure that stabilizes the structure around it, where you have a keystone that holds everything else together. And what he was trying to say is that the airway really is that nexus in the individual's health and wellness, because the most basic function in any mammal, moment to moment, is just taking that next breath. Not worrying about whether you're breathing 2 minutes from now, 5 minutes from now, an hour from now. It's just taking that next breath. And that's driven by the autonomic nervous system in the background. So from the moment that you're born,
The first cry.
From the first cry to your last breath, it's taking that next breath, because we're mammals. high metabolic rate, need oxygen, moment to moment. So if you stop breathing for more than a few seconds, there's going to be a stress response, right? So there are a number of aspects to the function of breathing that need to be addressed. One is the structure of it, and the other is the neurology or the function of it, right? And then there's the third, which is the behavior. So I like to say it's like hardware, software, and an operating system. Because breathing, it's a behavior, plain and simple. Not to be confused with respiration, which is different.
Autonomic. And to define autonomic, it just means all the things that your brainstem or your brain do in the background to keep you alive.
Yeah, it's your peripheral. It's your peripheral nervous system that does everything, as it says, automatically in the background. You're not really thinking about it. It's largely a brain stem function. And so, when you're doing this kind of thing, we're not really thinking about or willing our heart to beat or our diaphragm to take that next breath. It's just happening, right? So that's what autonomic is. So airway has to do really with understanding the structure, the width of the palate, the growth of the midface downward and forward, creating enough oral volume. So it really is important for the individual, and also form follows function. Those individuals that have a really good airway structure are those we would call a Paleolithic face. They have a really attractive face, square jaw, forward face, breathing very effortlessly through the nose, right? So, there's no other discipline in healthcare that knows more about it than, our profession of dentistry, right? Otolaryngology, ENTs, can treat part of it, the upper airway, the nasal part of it, for sure. And the pulmonologists and the like can be treating kind of the lower part of that airway, but you can't ignore the oral cavity, the oropharynx, the nasopharynx, the hypopharynx. And yet in dentistry, we tend to just really focus on these individual structures, the teeth, the gums, the bone, and largely ignore the tongue.
Right.
Yeah, the tongue. What's the tongue's main job? Is to dilate the airway. I mean, that's its main job, right? So, so airway, and yet its function, the function of the tongue largely determines how the face grows, how you feed, how you breathe, the posture of where that tongue is, what we call oral posture, how you swallow. So those are very important things.
And we kind of got off the track. I hate to stop you in the middle.
No.
I could listen to you.
No, yeah, absolutely.
But we kind of got off the track when we stopped natural nursing, and when we stopped having to eat unprocessed, uncooked foods, that 1,000 years ago or 10,000 years ago, or with nursing, in the last 80 years. And now when you see the consequences of that change in behavior, culture, diet, and you start looking for these things, it's like you can't not see them everywhere. So keep going.
So let's talk about that. So let's talk about where that started, right? So if we go into history, and this is all well documented, right? So this is like a consumer level interview, right? It's not like, we're in a big conference in front of other healthcare professionals where, we'd have a very specific topic that we'd maybe be talking differently and citing literature and supporting our statements. But if we go back to where it started, that's very well documented. So, Homo sapien, our species, about 50 to 70,000 years ago, developed the ability to have language. And that radically changed the game from an evolutionary point of view in how we ended up really dominating our environment, outcompeting all other mammals because we had this ability to speak. But it was a very large investment. It's largely what increased the growth of the brain radically, very, very quickly, because up to that point for, tens of thousands of years, we had tools and we were using our hands, but it wasn't until we had language that there was this big inflection. And so the way we lived as a species that also competed at the same time with, other species like, the Neanderthal. I'm sorry, I just had this preliminary to Neanderthal, that we did have this this period that there was coexistence, but Homo sapien ended up being outcompeted Neanderthal. In fact, we all have about 3% DNA from Neanderthal. That's very well documented. But why was that? And a large part of it was because we started having language. And that changed and started changing our behavior, the way we lived. But we worked or lived in very small groups of 7 to 10 individuals, really no more. We didn't live in large cities or towns. We were hunters and gatherers. So, you'd have a group of 7 or 10 Homo sapiens that would be able to maybe on occasion kill a gazelle and dig up tubers and berries, and you'd be able to share it and live okay. And you were hunters and gatherers. But it wasn't until about 12,000 years ago where we started really changing to what is considered the agricultural revolution, right around the Fertile Valley and then the Tigris and Euphrates Delta, where we started learning about how to grow our own food. So we would be nomadic. We'd move from one area to that looking for food. And we would maybe find some grain. Let's say it's, wheat. And we would dig it up and we learn how to grind it up and turn it into a food. And every season, we started noticing that there was more and more of this wheat around, coincidentally, from where we had gathered it, and figured out, hey, we could actually plant this. And so it allowed us to stay in one area and start, growing our own food and our food supply. So we didn't have to move. And then we would start having, habitations and little towns, if you will, and started having domestication.
Trading centers.
Yeah, and domestication. Well, that's way later.
Okay.
This is just in the Paleolithic period. So that really started changing radically the way we lived as a species for literally hundreds of thousands of years. So it depends on, which data that you're looking at. But for a long time, all of a sudden, we started behaving differently. And everything was fine. And that ended up evolving to more and more organized societies. And then about 500 years ago, there was another big inflection called the Industrial Revolution that started even changing the modern way that we were living from hunters and gatherers to social beings, to where even the structure of how the family would work, where now, the mom that would take care of the children at home, now she'd be going off to work to factories to make textiles, right? Because there was trade and prosperity associated with that. And so they'd hand the kids off to the wet nurses, right? And they'd go off and so it started changing the game. And why I bring that up is because now the infants were maybe fed the same way that they would have been before. And then that continued to change to where now we started, putting them down, versus when you're a hunter or gatherer, you take the infant and hang it on your front or your back, and you'd be looking for tubers and hunting and gathering. But when we started taking the infant and laying them down on the ground, that's not the way we were designed. You started having, flatter heads, what's called plagioccephaly. And that started creating some disharmonies in our craniofacial growth, as nuanced as they were. And then, then the notion of taking foods and pureeing them because there was a concern that the infant would choke. Whereas in the past, in the Paleolithic period, the mom would take food, the baby would nurse for 2 or 3 years, and then they would be weaned to solid food, where mom would maybe pre-chew some cantaloupe or some fruit and then give it to the baby. And the baby developed a neurology of how to properly chew food without choking. And so it's not really a small matter, because our species, Homo sapien, we're the only mammal that has the risk of choking. No other mammal has that problem. And the reason why we have the risk is because we have language. I'm not going to get into all the physiology and the changes in structural arrangement when we became bipedal and our faces became flatter, increased the risk of strokes. So as we became more and more modernized, we started changing our environment, how we would go to the bathroom, how we would sleep, what we ate. So this is what we call modern living. Then you started having cities, more pollution, more, and then now we've got, telecommunications, and you've got, the energy way. So a lot of people kind of poo-poo that, but the point is that we've really radically changed our environment from the Paleolithic environment when we started as hunters and gatherers, without really understanding what it was doing for us. Let's just look at even 20 years ago, how children were born. The OB/GYN would schedule a C-section, would say, well, 38 weeks, I'm going to go on vacation. Let's just schedule your son to be born right before I go on vacation, C-section, and so they're able to deliver. Yes, infant mortality went way down, but there were some changes there, because now that infant was not populated with mom's flora. The vaginal flora that actually coated the baby as it came out actually kickstarted their immune system, and things that we didn't think about. So those kids have a higher risk for, allergies and other immunological issues that are certainly not insurmountable. Not breastfeeding, where, with breastfeeding or nursing, it's more effortful, and that caused the palate to start expanding. And so the baby can feed and breathe at the same time, right? And so what do we do now is we would put the baby on its back with a bottle, and now we're almost drowning it, right? Because that's in nature, you never see that. What other mammal is sucking milk on its back, right? Mm-hmm. And so we're kind of saying it's convenient. And then we make sippy cups, because it's inconvenient. When the baby's on their high chair, they're playing with their foods, they're testing it, they're developing, an understanding of texture and hardness and all these things that are developing neurologic circuits that allow us to function. They're called central pattern generators. But, you give them a bottle of water to develop that coordination to drink out of, but, they spill and make a big mess. So, what do we come up with a solution, right? A sippy cup. So they spill it and there's no mess, you just pick it up. But then now the baby is sucking from a cup that interferes with the development of normal swallowing reflexes. And why that's important is those swallowing reflexes help to develop the face. So if we look at our society today and you look at their profiles, you look at their faces, mid-faces, it's pandemic. It's everywhere that our faces are not the same as they were 500 years ago. In fact, I'm involved in a study right now where we looked at 250 to 300 skulls from the early medieval period, and we made all these measurements, and we're comparing it to our current population with a specific software that's very accurate in looking at three-dimensional measurements to compare to what the anthropologists did with calipers. That was very accurate. And they have these tables and these spreadsheets from those measurements that were looking at these individuals during the early medieval period, during the Black Plague. Well, we're comparing those populations, and it's radically different. And so...
what are some of the most obvious things?
Intermolar width, the width of the piriform aperture of the nose, the width of the mandible, the projection of the jaw. We're a lot more retrognathic bimaxillary protrusion. If you look at more and more in our society now, it's almost like it's so well known in our culture that our cartoons are representative of what we see. So the artist sees, like The Simpsons, right? Look what those characters look like.
No chin.
The artists just do that. That's just what they see. It's a caricature, but that's what you're seeing now. And then, there was facial growth. A lot of males will grow facial growth to hide their weak chin. But all right, so that's form and function and aesthetics. Who cares if you're healthy? But the problem is it dramatically increased the incidence of obstructive sleep apnea. Not even obstructive sleep apnea, because that's the tip of the iceberg, but sleep fragmentation as it pertains to breathing, which is its own topic, because everyone's just looking at obstructive sleep apnea, which is low-hanging fruit. That's just a small fraction of the population.
Because really, it's the influence of the changes in the airway that have transitioned into difficulty ventilating in your sleep, and then that has stirred up your autonomic nervous system to keep you alive, but not allow you to get regenerative, healthy sleep.
Yeah, so let me use an example with children. Parents don't know because their pediatrician doesn't ask and the primary care physician, doesn't ask, although it's changing now. But, I talk to parents all the time. I take a birth history and then I ask them, okay, well, how's your kid sleep? Well, I look, they're sleeping. But they're not seeing if the kid is sleeping on their stomach, if they're mouth breathing, if they're drooling, if their head is hyperextended, if they're using a toy to hold they're trying to breathe. And what happens is they wake up in the morning, they're cranky, it's hard to get them up, they go to school, they can't pay attention, they get diagnosed as ADD, ADHD, because their autonomic nervous system is able to maintain the oxygen levels so that they don't have what's called chronic intermittent hypoxia, where they have desaturations that affects brain development, is very pro-inflammatory, many studies to show that. But it comes at the expense of their sleep. So they don't get that deep sleep. They can't release growth hormone, the metabolic hormones. So it creates a lot of problems. And then they get that big misdiagnosis, ADD, ADHD. Most ADD, ADHD in children and even in adults is really sleep fragmentation. But what's the solution that...
Well, it's caused by sleep fragmentation. And to interrupt here for just a second, I'm the dog at the vet, and I'm the vet and the dog, because I've gone through almost all of these things in my lifetime that you just described.
Mm-hmm.
So
a lot of my patients, start talking about it. They come in, the problem that they had started way before. When you start talking to them, they go, yeah, how'd you know that? I had that since, and they think it was a personality trait, or they're cantankerous, or they can't stay. But, the example I would use, like for, let's say, a hyperactive child, just as an example, it's easy to describe. Like, let's say you're an adult, I'd talk to mom. I'd say, well, let's say, mom, you didn't have a really good night's sleep, but the next day was a big day. You had all these things that you needed to do. How does that day go? Of course, it's really hard. And they're downstairs, and their husband comes in, or their wife comes in, or whatever, and says, hey, honey, did you balance the checkbook? Did you get this done? And it's like, the spouse kind of says, well, oh, wait, honey, let me get that second cup of coffee in, and then we could talk. And so then they finally have that second cup of coffee, and then now they can interact because their prefrontal executive function is now online. They had bad sleep, takes them a while, they have a stimulant, and then now they can function with cognition, right? They can answer those questions more sharply. Well, so a child doesn't have that, right? They just wake up, they're sleepy, their prefrontal cortex is firing very, very inefficiently. If you did a functional MRI, you'd see that their prefrontal cortex, lights up like what you see in a kid that has frank ADD, ADHD. And so what's the solution? They go to school, they can't sit down, they're not paying attention, they're getting in trouble, they're fidgety. Teacher talks to the parents.
They can't learn.
They can't learn. So what do they do?
They can't remember.
What do? They give them a medication that we put people in jail for if it's spot on the street. Adderall, Ritalin.
And they label them.
It's methamphetamine, essentially. So what are you doing? You're giving them a stimulant. So you give them a stimulant, and now they wake up, and now they could sit, and they could listen to the teacher, and they could be online. So ironically, whereas they were hyperactive, you give them a stimulant, idiosyncratically, they have the opposite effect where they're sitting there, and now they could pay attention, and now maybe they can, take the test, and they can work okay. The problem is that they're treating a symptom of a bigger upstream problem, because if you look at the studies, looking at brain scans on these kids and the brain damage that's done from this fragmented sleep, it's huge. They have upregulation of all these cytokines, IL-6, TNF-alpha, highly sensitive C-reactive protein. Their brain is absolutely aflame. And once that happens, it affects every organ system in the body. And so it's a huge problem. In fact, ADD, or Adderall and Ritalin are the most prescribed drugs. And interesting, last week, we're in February 2024? Last week, there was a national report.
Suicides.
With females. The number of diagnoses of young to middle-aged females with ADD, ADHD more than doubled in the last 5 years. And so there are people that are blaming it on their devices. They're trying to come up with a solution, but they're barking up the wrong tree. They're not asking the basic questions. I see those patients all the time from all over the country. They come in, you talk to them, they almost start crying in the chair, and they go, "Oh my God, this is it. No one ever asked me that." They all have fatigue, functional somatic profile, fatigue, irritable bowel syndrome, temporomandibular joint problems, headaches, mood swings, anxiety, depression, all that. Those are all autonomic nervous system.
I remember the first time I took my daughter in to see someone, and she was diagnosed as ADD, and then she turned to me and she said, "The apple probably didn't fall far from the tree," and she gave me something to read, and I read it and I cried, because I'll cry right now if you want.
Yeah.
But it explained so many of the difficulties I had as a child growing up and educationally.
Yeah, but it's a huge
thing.
It's a huge issue, and it's pandemic. The pediatricians,
it affects everyone.
They're so frustrated with the pediatrician because they go in for their well check. It's all about vaccinations, and mom may have some concerns, and they say, "Oh, don't worry, they'll grow out of it." You wait till the tonsils get so large because they're mouth breathing, and then you just remove them, right? That's like over-treating the wrong problem. We need to start understanding the organic problem with breathing and sleep. Dr. David Gosal, who at the time was, I believe was at the head, was the physician in chief of the University of Chicago Comer Medical Center, right? And he was head of pediatrics, and he did a study. You could Google. It's called a sleep restriction study, where they took two groups of children that were 48 years old, and the one group,
you couldn't get away doing the study now.
No, it was an institutional review board. It was not a problem. So they took these kids, and they all had sleep studies to rule out that they didn't have a frank sleep problem like obstructive sleep apnea. They did neurocognitive testing. It was standardized neurocognitive testing. And they did functional MRIs.
I thought you were going to say they wouldn't let one group sleep at all.
Well, I'll tell you. The functional MRIs really looking at their brain function like a heat map. And so the experimental group of these 4 to 8 year children, they were age and gender matched to the control group, right? Was allowed to stay up 1 hour past their bedtime, just 1 hour past their bedtime. And what they found after 1 week of just one less hour a night, that group, none of them had sleep apnea. That group, their functional MRI lit up just like you see in ADD, ADHD, and their neurocognitive testing was significantly poorer 1 week later. And so you could see that just not being able to sleep during brain development for one less hour is huge, because it also causes all these inflammatory processes in the brain during growth and development of these children. In fact, the Wall Street Journal, I believe they're the ones that caught wind of when the study was published. They looked at it and they did an economic study looking at, because one of the findings was that children can have a drop in IQ points of 12 to 15 IQ points. And what they did is they did an economic study to look at how much one drop of one point drop in IQ would it meant economically in salary for a child. And it was something like, I can't remember exactly, it was something like $25,000 or $30,000 a year salary per IQ drop point for the rest of their life. So imagine if you had a 5-point IQ drop because you weren't sleeping during that period of time, multiply that, but for the rest of your life. So socially, it locks in a population into not being able to attain their best potential. So there was a big hubbub about what it really meant. And so as Dr. Gozal would say, well, if your kid has an IQ of 120 or 130, pretty high IQ, a drop of 5 points may not be detectable. It's not that big a deal, right? So no, my kid gets A's all the time, top of the class. That's not really the question. Did that kid really reach their full potential, even though they're high functioning? So it makes it very, very nuanced. But how about that kid that's maybe struggling with an IQ of 90? That 5-point IQ drop will completely change their life. So there are a lot of social ramifications for really making sure that we could spend that 1/3 of our life that we spend in that one state that we call sleep, that we do it very, very well. Efficiency. Nature would not invest 1/3 of your existence on this planet in a state if it wasn't really important. Now, the fact that you don't really understand it doesn't change the reality. We're starting to understand more. And we're starting to get into allopathic medicine is starting to really understand.
Allopathic?
Regular Western medicine is starting to understand the Germanic model. But the fact of the matter is that there's a Starbucks in every corner. There's energy drinks. We propel ourselves all the way. You have bad sleep. You have your Starbucks. You make it through the day, and about happy hour, we kind of have to, walk ourselves off the ledge. There's happy hour. And that kind of down-regulates our autonomic nervous system. You have a glass of Chardonnay, you're back into, maybe parasympathetic coherence, but then you have that second glass or that third glass, and now you don't sleep very well. And then you repeat it all day long like the hamster. And then you start becoming obese, and you start having type 2 diabetes, and you start having cognitive issues and all the chronic diseases. There's so much data. World Health Organization has published huge data looking at chronic disease. Yes, we're living longer because of modern medicine. That's great, but it's unsustainably expensive because we're keeping people alive, not at their best. They're getting sick at 12 and 13 years of age. Type 2 diabetes. It's totally environmental. And then you have that the rest of your life. Amortize the cost of that and what it means. So they're really huge. We really have to change our healthcare system from a disease management healthcare system. There is fundamentally a difference between not being sick and being well. It's just that most providers don't know what well is. What is that? So I could get into that whole discussion of competence versus compensation. But anyway, so that's just a short ramble, if you will, on the ramifications of Airway. It really is the nexus of our health, not the food supply, not exercise. Those are all important, because the mammals are meant to be stressed. Our bones are meant to be stressed with exercise the way we did for forever. And of course, you're going to eat very differently than you would if you weren't. Those are all factors for sure. So there are many things that are at play, but everyone tends to focus or bark up the wrong tree. They're not looking at the basic things. So now you have people like James Nestor who wrote a book for kind of the public. People are starting to understand about breathing, right? Called Breathe versus sleep. You know, there's a difference. Sleep disordered breathing starts as a breathing problem first. There are now a number of books that people are starting to raise awareness, and it's really grassroots. It's coming from the public at large. The healthcare provider's like, you know, it's like, I'm just doing my thing. People are coming in and asking me these questions. I don't know anything about it. And yet that's how we're going to change the healthcare system is the public is going to start demanding something different. So with that, I know we've been going on for a while. I'll just take a pause here unless it's a specific question.
No, this is why I love being down there, because I could just listen to you for hours and hours.
Go on.
And as I said earlier, I don't, having listened to so many speakers on so many topics over the last 50 years, you just don't run across people who understand, can diagnose, and come up with a simpler, more effective treatment than you have. So my hat's off to you again.
Well, let me say it's not simple.
Well, it's simple compared to the alternative.
Yeah.
The old alternative was 8 to 12 hours of surgery, 2 surgeons, and $80,000.
Yeah.
And the 3 to 6 month recovery. Now you're doing this in 1 week recoveries with minor surgeries in comparison, and you're getting better results.
Yeah. Well, I think it comes down to if you really understand the problem.
And let me say now we jump switched from causation and children and growth and development to you're already done growing. Now, how do you treat this deficit in bony growth and development and airway restriction? And that's the next phase.
Yeah. I mean, so that's
the next
treating a diseased population. Right. Because if we look at digs 4,000, 10,000, 2,000 years ago, or how our skulls were, it was very different than what we're seeing now. Unless it was a diseased population, which that occurred, but you never saw dental crowding, or very rarely. You didn't see a lot of the problems that you see now. That is a rite of passage. It's expected that every teenage kid or pre-teenage kid is going to be in braces because they have crooked teeth. It's not a tooth problem. It's a growth problem.
It's a bone problem.
It's a bone problem. So, and we never saw that before. This happened, and it's feeding an industry, profession, so much to treat a problem that should never occur. But let's just set that aside. Let me say that it's not simple per se, but it's very understandable. And that's the first thing, is understanding, the competences that we should have when we're born to be able to have optimal function. For me, I practice as a team. I'm not by myself. And one of the reasons why I finally am writing a textbook, so I have a contract with Elsevier, which is the most respected publisher of scientific media, right? They do textbooks, New England Journal of Medicine, The Lancet, et cetera, et cetera. Everyone knows about Elsevier, and they're making a big investment. And I got tired of people saying, you got to write a book. And so I and my partner, Barry Rayfield, are doing it. And we have probably 6 to 10 contributing authors from other disciplines that are really putting this together in a way that will break it down to where it's very understandable, to where it'd be very difficult to walk away and say, this is not an issue. It's going to really force you to rethink how you think.
Those other disciplines described for just a second.
Otolaryngology, pulmonology, sleep medicine, orthodontics, allied health professions like occupational therapy, sleep and language pathology, physical therapy, et cetera, et cetera. It's all in dealing organically with growth and development,
Pediatric neurology,
pediatric, all those. So pediatric sleep medicine. So that we're going to have contributors that is all science-based. We have over 400 peer-reviewed references from high-level references from medical, dental research and beyond. Physiology, we have physiology. So writing it to really talk about how do we understand this problem, and so and you can't do this by yourself. The thing is, as dentists, we are kind of trained to open up our own practice, kind of like an outpatient surgical practice. You just do procedures by yourself.
We're little wood makers.
Yeah,
woodworkers.
We're very mechanical.
Yes,
very mechanical. We have to work as a team. The problem with disease management,
which is a necessary component for restorative, or as I call it, collision repair dentistry. But go on.
Yeah, we're very siloed in how we're trained. We work in small groups, and there's an incentive to become more and more specialized. I always joke that, we're learning more and more about less and less till we know nothing, right? So we know more and more about, but that's not the way the body works. So you kind of have to have a global view of how the heart interacts with the digestive system, with immune system, with respiratory system, with the renal system, et cetera, right? Digestive system. So and we can't do that by ourselves. We have to have a team. But we can't ignore the very basic biologic imperative of every mammal, and that's breathing. And we've, up to this point, you ask the average physician, ask them, what do they know about sleep? Maybe they get an hour lecture on sleep. Considering that you spend a third of your life in that existence, do you think that's kind of weird that you only get a 1 hour lecture on, they know everything about the tendons.
And it may be based on a knowledge base from 40 years ago or 50 years ago.
Yeah, exactly.
Because nobody's been interested in it for 40 or 50 years.
Yeah, and I'm not going to criticize, it is what it is. It's just our system that's been set up in the West. I think it's just time to really kind of step back, right? And look at the problem a little differently. So with that, I think, I'll just take a pause.
Thank you for coming. We've really just
Are we doing it?
We've really just hit the tip of the iceberg on this, and we've kind of covered some growth and development and some about our children. At the next episode, we will try to go into the next bracket or group or age group, and we'll try to go into some of the solutions. Okay, so thank you for seeing us, and we welcome you back. And at some point, we're going to be entertaining questions from you and trying to answer those questions. And Dr. Cruz, thank you very much for being here.
It's my pleasure. I think it's always good to really understand the topic, the problem first, just to kind of get out there. We could spend so many more hours really getting into different details, but this is like a really good maybe overview. And yeah, then we could start getting into like specific aspects of it, age groups, interventions, how do you prevent, how do you detect it? What are the things you look at if you're a parent? What are the questions you ask yourself as an adult to see if you have the issue?
And the overview also is that it affects so many people, probably limits the potential of 85 to 90% of the population.
Well, just, let's just...
Now let me... I just pulled that out, but it's probably a truism.
So let me end on this, which is something that I mentioned, is the anthropologic standard. Clearly, there's very good data, and the anthropologists have been talking about this for decades, and they've been largely ignored by healthcare until recently. But that it's been dramatic, that literally on an evolutionary scale, in a nanosecond of that time scale, our species has changed how we've grown very, very quickly because of environmental risk factors. So clearly it's a global problem. And we'll leave it at that and switch gears and talk more about how you fix the problem the next time. Thank you very much.
Thank you. Thank you.
Thanks.
Thank you, Dr. Cruz.
Sure.